lot of trans men avoid care because they anticipate that they're going to face problems. So in my case, I called 3 separate providers who said to me, like, we don't treat patients like you.
What are some of the biggest challenges as a CEO?
They've done studies with Latino populations where they get diagnosed much later for cancer. Once you've experienced that people treat you differently because of how you appear.
When do you think it's coming for health equity?
How do we create the data pipelines and the ability to even track our population and to segment the population? So the key thing that we learned is...
Let's talk about your company.
Really key point for working in healthcare is...
Hello and welcome to another episode of Healthcare Journeys. I'm your host, Claudia Gallardo, and I'm thrilled to have you with us today. On this show, we explore the personal and professional journeys of healthcare leaders who are shaping the future of our industry. Today, we have a very special guest, Joseph Schneier. Joseph has over 20 years of experience in healthcare and technology innovation, and is currently the CEO of Circle, a company using AI to improve healthcare access. He's a true visionary who has founded multiple companies focused on serving older adults and advancing health equity. Joseph is also a dedicated mentor and advocate for the LGBTQ+ community, serving on several boards and councils. Joseph, welcome to Healthcare Journeys. We're excited to have you here today.
It's great to be here.
Yeah, it's exciting. Finally, we made it work. I had mentioned to you that a long time ago, I had watched one of your interviews. And back then, many years ago, I thought, I don't know how, but we're going to work together at some point. So I'm excited that we finally making it work. And thank you. So Healthcare Journeys, that's our podcast. So we want to hear from you. Do you mind sharing a bit about your background and how you got started in the industry?
Yeah, happy to. So I studied computer science a long time ago in the 90s. It was a different universe.
Not long ago.
But I got my career started actually in educational technology, and I was looking at ways to help people to learn things that they didn't feel like they were capable of learning, was the focus area. So my pathway to healthcare was a little less straightforward than some people. So I got approached by these behavioral research scientists after I sold one of my companies in educational technology. And we were looking at whether or not we could apply some of the methodologies we were working on in education to patient behavioral change. And so we were looking at things that were really complex situations with populations that were faced unique challenges. And we're looking at really how could we do longitudinal studies to ensure that the outcomes we're aiming for were actually reached using technology as the end tool, but based on a whole bunch of research with these different researchers. So it was not a straightforward path into healthcare, but it was a lot of fun to work on. And I got kind of hooked in the healthcare setting. And have gone on, as you mentioned, to found a number of companies, primarily in the elder care space. And yeah.
I mean, it does sound that your background is a little more, was a more direct path to healthcare than others, nobody ends up saying, "Oh, I'm gonna go into Medicare Advantage." Like it's it seems that you were a little bit ahead of your time. Also, looking into influencing care, right? Like from the patient's perspective, which is now it's when we're seeing a lot of solutions that are designed to influence member behavior. So you were a little bit ahead of your time. So
also on the elder care space, when I first started in that sector, I remember some venture funds I was talking to that said things to me like, "Oh, don't talk about old people. Nobody wants to hear about that. And I was like, you guys, there's
that's the market, that's the way.
yeah.
Those are the members who need us the most.
Yeah.
Yeah, absolutely. And that's a segment that needs a lot of help. I want to just take a moment here and ask a question. I think it's important, and we'll go back to Medicare Advantage. We have a lot to talk about, but you've mentioned that your gender transition had an impact on your work. I don't know if you're comfortable to share like your experience, how it's influenced your personal and professional life and your journey in healthcare.
Yeah, I'm happy to talk about it. And there are many ways that it has influenced my life, obviously. From things of just the generic of running a startup in female presentation in the early 2000s compared to running a startup today in male presentation is very different. Let's just put it that way. In some ways, I think that would be surprising to people. So that's more of just like the general running a startup. It's quite different. And then in terms of healthcare itself, it's been a really interesting journey because it has provided me with both the ability to see three things. One, what is it like to be a woman moving through the healthcare system? And then two, what is it like to be a man moving through the healthcare system and how you're initially treated? And then third, as a population that has its own unique health challenges, facing those challenges, lack of knowledge and training in the healthcare workforce, and then a lot of just blatant discrimination, which was really surprising to me.
Your journey. Yeah, you have mentioned in our previous conversation that happened to you. And I went back and wanted to learn more. And you actually gave an interview about it. And I was very shocked that had happened to you. Do you care to elaborate a little bit of what happened so people understand? I think it's very important. And I was actually extremely shocked and upset on your behalf. Like, we're talking about healthcare. It shouldn't matter who you are, or it doesn't matter. You're a human being and in need of care. But if you want to tell us a little more.
Yeah, absolutely. So first of all, I think it's important to note that I live in New York City. So this is a place where you would think probably one of the easiest places in the country to get care if you're a transgender individual. And so this was started in 2022. I started to have some, I think it was 22, might be 21. Anyway, I started to have some medical symptoms that I was concerned about. And I reached out to a number of different doctors. And just as a backdrop, it can be really challenging to overcome the sort of the stigma that you think you're going to face if you, as a trans man, if you approach getting care from a GYN. So a lot of trans men avoid care because they anticipate that they're going to face problems. So in my case, I called three separate providers who said to me, like, we don't treat patients like you. We're not going to see you. And the result of that was I delayed for quite some time finding a doctor because it was hard enough to make the initial phone calls, and then to deal with that was terrible. And the part that it was really important to note is that by the time I finally got to the doctor, it turns out that my symptoms were because I had cancer. And like, if I had been treated earlier, the situation would have been a lot easier. Yeah. And I think about that a lot, because if I'm walking down the street, people are not looking at me saying that's the type of person that's going to experience discrimination, especially in New York City. And now I think if it can happen to me, there's a whole ton of different populations that must be experiencing similar things.
Yeah, for sure. I think there are challenges for sure accessing care and getting the right diagnosis at the right time. I've experienced them, and you know, everybody has So when that has a health issue, I think I've heard from other people. I kept going to the doctor. They couldn't find what was wrong with me, and then I
Right.
ended up having something. More so, populations that are already at risk, like more so, there should be sort of like an action taken to say we need to actually look at this. Not that, you know, we are not going to look at others and say, well, you know, let's look closer to this population. Obviously not, but they do deserve access, quick access to care, elderly, LGBTQ plus. It's hard. I mean, it's hard to
Yep.
get just as a regular person, like just walking down the street, like anybody getting access and finding a doctor that would actually take you and see you.
Right. And the thing is that on top of that, when you have the challenge of discrimination within the system,
Yes.
so you're dealing with just the normal things of it can be hard to get a diagnosis. I had some other problem this year that was just hard to get a diagnosis for just because it was challenging. But when you put up these barriers because of lack of training, and that could be like, they've done studies with Latino populations where they get diagnosed much later for cancer, or we know a lot of this stuff, but it still happens, and it's a real question for me about how we can start to retrain the
influence that. Yeah, and I'm very hopeful because people like you, founding companies, creating a dialogue around that, helping populations get care, because I also think, like you mentioned, maybe some members don't seek care because they expect discrimination. They already expect the worst, so they don't. Like, I don't want to go, they won't even see me anyway. So that is hopefully changing because of people like you. So
yeah, I hope so.
Yeah, absolutely. I know that you go to a lot of conferences, and in our champion for health equity, right? Like access to care for everybody, which is so important. So I just want to take a moment and ask you, because you've gone through a lot, and it was a big change in your life, right? Like I can even imagine, like it's impactful in every single way. So what are some of the biggest challenges as a CEO? Because your perspective is unique. So how your perspective has helped you navigate those challenges?
I think it's really been very useful to be able to take a step back and realize, like, once you've experienced that people treat you differently because of how you appear, it does make you, in your conversations with people or as you're approaching systems, really think about, like, are we coming to conclusions based on things that are actually real data or actually really what's going on? Or is it because of these preconceived notions that we have about the people that we're working with? And that can, and taking the time to stop and think, like, I don't know really what's going on with this person in front of me. There could be a whole host of things that are happening behind the scenes that I don't see. And I experience that a lot now. People have preconceived notions about who I am today. And that really helps me to, in both working with my employees, working with a customer, to help them to figure out what's their challenge. And then especially really thinking through prioritizing the patient at the center of all the things that we work on.
Yeah, absolutely. I think empathy goes a long way in business, and it's very underrated.
Yeah.
Yeah. So what topic within healthcare are most passionate about? I know, but maybe our audience doesn't know. So
We do know.
What makes you, maybe I'm assuming a lot, but maybe based on what your sessions have been at different conferences, but what topic inspires you the most in healthcare?
Well, there are actually two topics that have become really a primary focus for me. And the first one may not be the one that you would guess, but I'm really, really interested in how policy regulations and financial incentives, those structures, if we set those up properly and have the right data pipelines underneath it, can end up affecting consumers far more than a lot of the direct-to-consumer outreaches that we do. So I spend a lot of time thinking about how a policy change is going to affect the work that we do, is going to affect how seniors move through healthcare. And I think it's underrated, really paying attention to where the regulations are headed. I'm also just really interested in access to care, and clarity, especially in people really understanding how to access care, what does it mean for them, and that centers around a lot of things related to health equity, related to social determinants of health, but really, like, at the end of the day, how does an individual understand what's available to them, how to get it, and have it not be such a big headache to just navigate the system.
Yeah, health equity, it's this topic right now of that, that is extremely is in focus. There was even a full conference about topics related to health equity. But what do you think is the future? What do you think it's coming for health equity? How do you see it evolving in the coming years?
So for me, one of the things that's the most important in health equity, and where I see a lot of focus going, is how do we create the data pipelines, and the ability to even track our population, and to segment the population so that we understand what it is we're even looking for and how to actually reach a patient properly. And I'll just go back to some of my earlier work in patient behavioral change when we're working with complex populations. The key thing that we learned is you have to start where the individual is at. You can't want the person to think differently, to believe something differently. And if you want to change their behavior, that's where you need to begin. The challenge is that we don't know where people are at. We often don't know where they live. We don't know if they want to be texted or called. There's so many things about them. So for me, one of the things that I'm focused on in health equity, where I see there's a lot of movement, both on the technology side and on the regulatory side, is how do we improve the systems to be able to track who people are, what they want, what's going on with them, and make them more synthesized throughout the system.
Yeah, absolutely. I think that's what we're hitting. I think, I don't know if you agree, but there is, I think the challenge has been how to capture those data points, right? And how do you start? I was at a conference recently, and one of the conversations they had was about organic data points. Like the organic data that doesn't really get captured, right? Through conversation with a member.
Right.
They were giving the example of an elderly man who lived alone, and he had mentioned that since his wife had died, he just heated a can of soup and went to bed. Like that was his routine.
Right.
So from that, you can deduct a lot, right? Like he's alone, a risk for dementia, food insecurity. Does he, et cetera, and those data points are not really captured formally. I mean, that conversation wouldn't be, maybe in a note, but not in an organized fashion that a health plan can see the data and say, like, okay, so these are the factors to look for with him.
Right. And what's fascinating to me about that is, like, then when you look at other sectors, like you look over at advertising, earlier in my career, I spent a lot of time sort of looking at how does advertising effectively reach people, and they can now in the scariest of ways. Like, we're talking together means I'm probably going to get different ads on my phone. Like, they know the nuances of our behaviors, and how fast I'm scrolling, how fast I'm walking. All of these things are changing they're presenting in front of me. So the thing that gives me some hope is like, not that I want healthcare to do that necessarily,
yeah.
but we do have the ability to address these things. And it feels like it's an entrenched problem with no solution. But I think if we think bigger and look at what other sectors are doing, that there's a lot that we can be learning, both where they've gone wrong but what we can bring in. And then I guess the other thing I would say about that I've spent a lot of my career looking at is how do we leverage people who have touch points with individuals? Like, who is coming into the house and seeing that older adult man eating the soup, right?
Yeah.
Is it because he had a phone call with somebody? Is it because he, somebody came over to do the annual wellness visit, or he's got a home health aide, and how do we leverage each of those touch points to learn more about that individual in ways that benefit them from a health perspective, obviously with their opt-in. So.
Right. No, and it's all about integration, right? Like, I think members have multiple touch points, and those touch points are just not talking to each other.
Exactly. Yeah. Member facing, but also system facing. So the systems are not talking to each other. So there's no way to create a unified member experience, because behind the scenes, you don't have unified systems. And that's why I think like improving these data pipelines ends up allowing us to have the rails to run information, like a person who's eating soup at night might be eating too much sodium, there's all sorts.
Yeah, all sorts of data points. Well, this conversation makes me feel that you're thinking about your next company. So many ideas that are coming.
Just don't tell my partner.
Yeah, I feel like you have a great business idea in there somewhere. Let's talk about your company. I'm curious just to hear about, more about what you guys do and how did it get started?
Yeah, so we got started because my last company was selling into long-term care, so I spent a lot of time working with older adult population in that sector. And one of the things that I had been observing when I was working in that sector is that a lot of people had underestimated their healthcare costs during retirement. So the initial thing that we were looking at is like, wow, you have a huge number of people who end up having to spend down almost all of their finances on healthcare costs, and they didn't think that was going to happen. So when we started the company, we were looking at what levers could we pull to affect that problem. And one of the biggest levers you can pull is ensuring that somebody's made the right choice about their health insurance coverage. And there's lots of levers, but this is one that is a critical one for them. And so my co-founder and I founded this company. We put a consumer-facing, like unbiased Medicare choice system up, where people could come and really understand which plan they should be using. And the Department of Financial Services in New York shut us down in 1 week. And this was a really key point for working in healthcare is you have to get a handle on even regulations that seem illogical, like why can't there be this type of a system, but the reasons why the system is set up to not allow that to happen. And that took us down this road where we have ended up building out a platform that we sell both to health plans and to value-based care providers and ACOs that helps them both acquire new patients and members, make sure that patient is aligned with the right primary care, with the right health plan, so they experience less churn and better experience, like consumer experience with the plan, and then ensure year over year that person is retained. And that can be things like improved communication with the member, or at the end of the year, making sure somebody, if they're dual eligible or on Medicaid, we're doing the right eligibility checks to make sure that they're still eligible and they're not just rolling off because of some administrative problem. So we focus on that circle, that life cycle journey from sort of first touch points throughout the year of how do you improve getting people the right information around that particular choice.
Excellent. And is this like website based? Do you have an app as well?
Yeah, so the product is pretty comprehensive, and I think the way to think about it is it's more it's used more by the people who work in the system to
Right.
empower them to provide this information correctly. So
Okay.
it's like if you were to combine Salesforce and Bill.com and Zendesk into one product. So some of the pieces of it are consumer facing, but we're empowering these groups to have a consumer facing interface.
Interface.
Yeah. And to answer your question directly, it's a web application because we find with this population that's a lot better.
Yeah.
Downloading another app that they have to track is just not as useful for them, neither on the workforce side in healthcare or the end users that we work with.
This is awesome. I mean, this is obviously in line with what you've mentioned about your journey, and so it's great that you have this company that is helping this process so directly. Is needed, and you also are a speaker at a number of conferences on a number of topics, and you're a very busy person. How do you balance professional and personal life? I always see you super busy as a CEO of a company as well.
Yeah, it's interesting is that before I went through chemo, I always was like, I could say the words of work-life balance, just like most CEOs, but I was still working 70 to 80 hours a week. And there really wasn't a lot of work-life balance.
Yeah.
And what's happened, which is maybe one of the upsides of this experience, so I'm still in some treatment, I can't work more than 50 hours a week. And so I have to, which has been such a great constraint, to learn how to better delegate, learn to say no to things that are really going to be useful, and to because now I can't be that person anymore.
Yeah.
I did have sort of an identity crisis at the beginning of that because I thought, well, can you be a CEO and live in startup land and not be a person who works 70, 80 hours a week? And so it's been really interesting, and I can't say I am a work in progress. Let's put it that way. But
yeah, it starts with wanting to change, right? Like to have.
And I do discipline myself to take at least a full 36 hours off on the weekend, and spend with my family, spend with my kids, and make sure that I'm just completely turn off electronics completely and really try to recalibrate every week.
Well, that's important. I think a lot of people are doing that like you work a lot, like they have these windows of like, okay, I need to connect and then go back to work. Okay, one last question. Looking ahead, what excites you the most about healthcare?
So on a personal level, some of the things that excite me the most are there's been a lot of work on early detection of cancer. And as a person who's gone through a cancer that is not easy to detect, I think it's just really exciting to see some of that work happening. And, on a larger scale, starting to see more and more collaborations between different stakeholders in healthcare. And I think that's so critical. We've talked about breaking down silos forever. It's kind of a cliche conversation to have, but to see that happening in action is really exciting. And I think it's the start of what can really be transformative in the industry.
Yeah, I mean, that is really important. And I've also noticed that companies more and more are more open to partnering with other companies, whereas before it was like, well, no, like it was almost like a separation that, well, we don't partner, we do different things. I'm like, no, let's partner. Why not? Like, let's just do it. And I think that openness is helping, or will help a lot. Well, thank you so much for joining us today. It was a great conversation. I'm looking forward to, learning more about your business. We're connected. If you guys don't follow Joseph Schneier on LinkedIn, please do follow Circle. They're a great company doing great things. Anything else you'd like to add before we say goodbye?
No, just great to have a conversation with you and to dig into some of these important topics. I really appreciate you taking the time.
No, thank you. And thank you to our audience. Please remember to follow S2M Health to see this episode release and for more episodes of our podcast. Thank you. Until next time.